So the doctor has to try and work out. So he uses a risk analysis process to do it. Let's imagine that you go into your doctor's and the doctor's got to try and work out what's causing a cough that will not go away for 2 weeks. Probably he's thinking that it's likely to be bronchitis. That is the most common cause. But it could be something much more serious. It could be lung cancer. It could be tuberculosis. They are both influenced by or indicated by having a very bad cough. So he can ask you some further questions. He can say, so he's making a judgment now. He's creating a view in his mind that is probably bronchitis. He can ask you a second question. Are you also short of breath? If you're having difficulty breathing, that doubles the chances bronchitis. So now he's pretty sure. He's actually doubled his view. So he's thinking now is bronchitis. However, he can ask further questions. Do you smoke? Because obviously he's trying to think about lung cancer now. No, I don't smoke. It's even more likely it's bronchitis then. So, but he's still got the TB one. So he can say, where have you travelled to recently? There are some parts of the world where there's more tuberculosis. So if he says, oh, I've come back from the Far East, from a country that has a big evidence of tuberculosis, which in this case is true, he will say, oh, so possibly it could be TB. He can send you for an X-ray, which would indicate TB. So he sends you for an X-ray, it comes back positive for TB, so therefore he treats you for tuberculosis. Now he's gone through a risk assessment process. Now you may use this in your organisation by looking at the various circumstances that can determine an event and assessing them. And I think that's a very important, different way of looking at risk. You would typically have a workshop first, but then analyse it from there. And if you want to find more about this, there's lots on the internet. Just look at Bayesian networks and it will show you lots of examples on how you can use this for your benefit.